Okay, here we are doing an IV cellular therapy treatment. This lovely patient has been a patient of ours for a long time and is dealing with a lot of different ailments. We chose to do an IV treatment today. Really, she's got a lot of inflammation in her body. She's got scoliosis, degenerative discs, but what's really been bothering her is her nerve pain from those degenerative discs. So today we did an IV to really hydrate her cells, and at the end of the IV, her vitamin IV, we made sure not to use any glutathione or anything detoxifying in it for the pre-prep care, but this is part of our pre-prep care. We wanted to really activate her cells, oxygenate her cells, hydrate her body, and now we're ready for the treatment. So we went ahead and took out the EXM product. We thawed it for about 3 to 5 minutes in her hand. So she's already set her intentions and is ready for the treatment.
I am.
We chose 2 cc's. When you're doing an IV push, you could do more. It's up to the doctor, the provider. A lot of people ask, how do you know what to do, IV or IM, intermuscular? We like to do IV here for any systematical treatment or addressing the nerves, anything autoimmune. Okay, so Ardell is going to do the treatment. Her IV just finished.
Yeah, so like Rebecca said, we did just pre-fluids with her with vitamins and saline. So with our tubing here, we have our port right here where I'm going to do the IV push with the EXM. We want to push this very, very, very slowly, at least minimum 2 minutes. Sometimes our patients feel some sort of head rush, so we want to make sure that we are pushing the product super slowly. And we'll just do little increments at a time. The EXM still has to travel through the tubing, so I'm just going to push that first through there.
And so she does have a 16 gauge needle in there because remember, you want to draw up the product from the EXM tube with a large 16 gauge needle so you don't manipulate any of the cells.
And then just another thing as well, it is clamped on the tubing, but just to ensure that this doesn't travel the other way of the IV, we want to clamp it here as well. And we're just going to push super slow.
Some people don't feel anything at all. Some people do. So every body is different, but that's why we like them laying down and just staying relaxed. I think people are often surprised how such an incredible treatment could be such a quick treatment as well. We started Jessica with, we always like to do an endermology treatment, a lymphatic drainage treatment. You can use any modality at your office really just to get the lymphatic system moving, reactivate your own cells. And then we like to use an IV to really hydrate the body, like we talked about, oxygenate your cells even more, send nutrients into the cells so that they can absorb the product we're putting in. There's so many modalities just within our office that, you know, it's within so many other offices that can really contribute to stacking this treatment to making it an even better treatment for you. Just like light or hyperbaric chamber. You're feeling a little bit, okay, yeah, she said she's feeling a little bit of an effect. Yeah, a little woozy. It kind of feels good. I love the way it makes me feel because I just, yeah, like almost like you just had a glass of wine. It almost feels like that.
Now we're done pushing the cellular therapy treatment through the port. So now we're going to flush with 10 cc's of normal saline, and we want to push this over 2 minutes as well.
We're pushing right now. This is just saline. It's just fluid through, but there were cells still in the tube, so you're still getting the product delivered to your body. So it's still part of the treatment. Okay, well, that was it. That was our cellular therapy IV treatment. Easy breezy. Yay!
Thank you so much.
Thank you.